Let's do chapter 24 first. All right, health insurance. So we learned a lot about health insurance last year, actually. Somebody still be in our review. Kind of crazy, isn't it? So it says health insurance is a contract between the policyholder and an insurance carrier, or it could be a government program. What are some examples of government insurances we talked about?
Medicaid.
Medicaid, Medicare.
Would Obamacare?
Well, one more in particular. There's one of these hospitals in Bonham.
VA.
The VA.
Oh.
Of course, there's also CHIP, which is the Children's Health Insurance Program, which is kind of a form of Medicaid. We kind of will go there. So Obamacare is not necessarily an insurance in and of itself. It's more like one of the things they talk about is just it's really the Affordable Care Act. It's just like a government policy law that went into effect. And under that, there was lots of changes.
Yeah.
And so one of the things that it created is like a healthcare marketplace. So if you don't have, of course, it requires that you have insurance. And if you don't, then you get a penalty on your taxes where that penalty comes in. The other thing that it creates is like marketplace. So you can go to the website and pick out what health insurance you want from there. So it's kind of a middleman for the health insurance companies. It did make some health insurance a little bit more affordable, for some people, and then for others, there's just no cookie cutter way to fix, insurance and medical issues. But I'm anxious to see what happens after this next election to all of that. Anyways, so that's it. So there's 3 ways a person can acquire health insurance. So it can be a group plan, as in, usually group plans are like with your employer. And that's typically your cheapest way to have the best insurance that you can have, really, is through your employer. And then you have enrolling in a prepaid health plan, and then of course you have like your standard, your individual health plan, so paying the premium on an individual basis. So you sign up for your own outside of an employer, whatever, health insurance plan. There's some other terms I want to make sure. No, not talk about you. Let's talk about those. What is a deductible?
And how much you pay to get something, like if you wreck a car, you'll pay a $500 deductible for them to buy you a new car.
Right. Yes. So deductible is kind of like that initial pay that you make in order to get the full benefits. So, for example, my C-section, $35,000 or however much it was. Okay, so you have that. My deductible, though, was like $4,000. So I had to pay that deductible before they would cover everything else. So deductible was a little bit more than that once you added the kid too, but like $8,000. Yes.
For like insurance and stuff, wouldn't they lose money since they're like asking for a little bit? You know what I'm saying?
Well, on somebody like me, yes. But, I already knew, that's one of the reasons I took out, I take out insurance anyways. But yes, like for me that year, sure, they probably lost some money on their end. But I'm still paying my premium every month for the next however long. And I'm not necessarily going to be in the hospital and have surgery every year. Makes sense? They definitely come out on top in the end. Otherwise, they wouldn't be in business. So, but one of the reasons that insurance gets more expensive every year is because we have more people who are living longer and living with health problems And so, you know what I'm saying, especially like with the baby boomer generation, they're all getting older, so they require a lot more health care, a lot higher cost of health care. So, but they definitely make their money. I mean, premium is what you pay every month. That's like the cost of the insurance. So every month I pay a premium. Now, usually with an employer, they pay a portion of it. Like the school pays a portion of my health insurance every month, and I pay a portion of it. You know, and then my kids' health insurance is on there too, and so we pay for that. Now, Matt, at his job, they pay for all of his health insurance, so we don't pay any health insurance for him. It's all paid for.
Like, what happens if he needs a surgery? And
Then
would y'all still pay the deductible, or would it be the?
Oh yeah, we still pay the deductible and whatever other fees there are. So, but his deductible is not very much. I mean, like, even I have some friends who are going to have a baby, and their deductible is like $350. That's all they had to pay. And I had to pay $8,000. So it's, you know, well, teacher insurance is not really great right now. But you know, it just depends on that. And there's lots of things to look at. But so deductible, premium, excuse me. Another term is a copayment. You've probably seen on the insurance card, like it says copay on it. Yeah, you've seen that on there. Copay is like a set dollar amount that you pay for a service. So, for example, on your card, it might say $25, like primary physician, $25. That means if you go to your primary doctor, you're going to pay $25, regardless of if that visit costs $300 or if that visit costs $75. You're only going to pay the $25. And basically what health insurances do is they set up a contract with a provider. So like, for example, so like at when I take the kids to the pediatrician, there's already like a set cost. Like the insurance has already worked out a contract with them that they'll pay, I don't know, $80. They can only charge $80 for a visit. We'll say, I don't know exactly what it is, somewhere around there. Even though their normal charge might be $120. They've already worked out that service, that contract with them, and so they can't charge me any more than that with my insurance. Does that make sense? So that's how they work out the service part. And then if I had a copay, then I would only pay the $25, and then my insurance would cover the rest of that. Now mine is not, I don't have any copays. We have to pay our whole deductible before anything's covered. So I'd have to pay that whole fee. But some of them, a lot of them have copays. My husband has a copay. And then sometimes if they see a specialist, it might be up to $50 or something. But it usually says that. If you go to the emergency room, it may have a $150 copay or something like that. But copays don't add up towards the deductible. So you have to pay those in addition to the deductible a lot of times. A co-insurance, if you hear that word, that's usually a percentage amount. Like Medicare usually have a co-insurance of 20% for Medicare. And that means that whatever the service is, you have to pay 20% of it. Medicare covers 80%, you're required to pay the 20%. A lot of people have other insurance that will cover that too. Like my grandparents, they'll have Medicare that will go on first. And then my granddad worked at, well, it used to be E-Systems, but I don't know what it's called right now. Raytheon, not Raytheon, L3. Oh. And so he still has insurance through them, and so they cover like that other 20%. So they can, you know, it doubles up like that. And I don't know, what does it look like from your end working in the pharmacy? What does it look like to do their insurance? Does it just run through a system and then it tells you what they owe, or
Yeah.
That's all?
And then like sometimes, well, it has to go to the insurance first, but like the insurance will sometimes decline it or whatever, just because it's too early or something. But we put it all in the computer,
And it takes care of all that.
I mean, there's been sometimes that we've had to call the insurance, like if they know it's not too early, like sometimes actually after they'll actually not do it, so they have to call the insurance, and the insurance will have to set it or whatever.
Yeah. Okay. Well, that's anyway. So that's co-insurance, copay. I'm trying to think of any other terminology that we about what premium is what you paid. It's like the cost of the insurance every month. Well, out of pocket is usually like what you pay out of pocket. Makes sense. There's usually an out of pocket maximum. So, like my insurance, and I don't remember now, even I don't know what it is right now because it's changed since I had Micah, but it was like an $8,000 out of pocket max. That means for the whole year, $8,000 was my max amount I'd ever have to pay. It didn't matter. Micah had been in the NICU for 3 months and charged up, $1 million bill. Then I still would have only had to pay that $8,000. That was the maximum amount. And then I have some friends whose kid was in the NICU for 3 months, and I don't know, $1.5 million in hospital bills or something like that. But their insurance covered it.
God.
It was crazy. Well, every little medicine, every little alcohol pad is charged, every syringe, nursing care, doctor care, especially in the NICU. There's lots of respiratory therapy, everything. Anyway. Okay. So a group plan, again, this is like usually available through your employer. Now, these are usually large employers. If you own your own business or have a small business, not necessarily you can always afford to do that. And the rules are different. Like even in the Affordable Care Act, there's different rules for small business owners. Okay, so group planner policy is any insurance plan in which a group of employees is insured under a single policy. There's usually options. Like we have 3 options. There's like a high deductible option, which is the cheapest one, and then it goes up from there. But they're all in the same plan. And actually all teachers in the state of Texas have the same plan. It's not just our school for us. And they're given individual certificates for the families. So usually, like I said, provides better benefits and offers lower premiums than individual plans. One thing about a lot of individual plans is they don't have maternity care for individual plans, which can be expensive, especially if you have to have a C-section. Okay, prepaid health plan. It says a policyholder enrolled group of policyholders, like subscribers, pay a yearly fee or a fixed periodic payment. So I've seen some of these plans like on commercials and stuff online. So you pay, whatever your premium is for the year, but you pay it. It's just kind of paid every time. Providers are paid by capitation, like we talked about. That's like a fixed fee. So the pharmacy might be paid $200 a month, regardless of if the person uses, $50 of medicine or if they use $500 of medicine. Okay, an individual plan says an insurance plan issued to an individual and their dependents. So you can usually shop for this online and you just get your own plan whenever you would get one from your employer. And sometimes that might be the cheaper way to go. Usually it's cheaper to go through an employer. Some people, like my dad, for example, runs his own small business. He only has, a few employees. And so a large group employer plan it's not an option in that case. Types of health insurance. So majority of patients have coverage, and at this point it's required. Everybody has to have some kind of insurance coverage. One of the things that they did with the Affordable Care Act too was they had tried to make it where more people could qualify for Medicaid. And I don't think Texas changed their Medicaid policy, but a lot of the states did, and the federal government kind of pushed them to do that. But there's so many people in Texas already on Medicaid. I think that's one of the reasons they didn't do that.
So you said that people have to have health insurance nowadays?
Yes, you have to, or you get penalized on your taxes. You have to pay this big penalty fee.
Oh, okay. There's people coming here all the time without any insurance. So.
Yeah.
You just cash it out to them.
Well, they get a deal. That's what the law says anyway. Everybody has to have. A third-party payer is an individual corporation that makes a payment on an obligation or debt that's not party to the contract. You'll hear that sometimes. Okay, so some examples of private insurance is Blue Cross Blue Shield. That's probably the largest one that you'll see. You see that a lot. There's lots of HMOs. HMO and PPO. PPO is Preferred Provider Organization, and HMO is Health Maintenance Organization. HMOs usually are, there's a lot of large kind of employee group health plans. HMOs usually have a lot more limitations on them. They kind of decide who you can see and who you can't see. Everything, like if I'm on a PPO, if I want to go to see a specialist, let's say I'm having stomach problems, and I can call up and make an appointment with the gastroenterologist. You can't do that with an HMO. You have to go see your primary doctor first. They have to make a referral. The insurance has to approve it. Then they can go to whichever gastroenterologist your insurance says you can go to. So it's a lot more, usually, they're more like that. Whereas a PPO, you can kind of decide preferred provider and get a good provider. That's what I have now too. All of the Texas Education Agency, whatever. Well, I don't know I guess TA is the one that decides that. But anyways, we all only have Aetna. Like all the schools in Texas, they just changed this year from Blue Cross Blue Shield to Aetna.
So like when we had to look up for dad surgery, like a doctor who was in the district, or not in the district. Yeah, I guess.
Yeah, in network.
In network. What is that? Is that the same thing as HMO? Like what you were saying about
Not
HMO?
necessarily. Yes and no. So HMOs just have a lot more. I don't know. They're just a lot stricter. Like PPOs, you still have people that are in network or not in network, but you can kind of pick between them. Whereas an HMO does more of like this,
They have one doctor.
like one doctor they want you to go see. Usually you have an assigned primary physician, and everything kind of has to go through them. Not always, but usually. And so, yes, but that's for any insurance. You're going to have to pick somebody who's in network because that means they have a contract with the insurance company. Same thing, like my dad had his pituitary tumor surgery at the end of the summer. And he had an individual plan, and they told him that they would cover whatever they said that they'd cover, but they wouldn't actually. So they didn't cover his insurance. They didn't cover his surgery or anything, which is pretty intense because it's like basically like a brain surgery. And anyways. So what happened was Baylor, which is where he had the surgery, because that's where he had it before, wasn't covered. But one of his doctors was covered. So, I don't know, it was just really weird. So part of it was covered, but then they wouldn't cover a big chunk of it too. So it's really kind of a strange situation. But yeah, it's really important to figure that out, to know if your person is covered or not. Workers' comp is offered by employers, and if you get injured, that's only for like an injury on the job, and you can qualify for workers' comp. And usually you only qualify if you're not doing something that is, like if you're following the rules and doing something. Like if you're, like let's say in your job you drive somewhere, but you're driving, say you're driving way over the speed limit and ran a stop sign or something like that. Workers' comp may not cover something like that because you were at fault kind of thing. Blue Cross Blue Shield, it's just one company. So it says they're required to pay a fee in advance of services, usually a copay or something like that. So they cover all kinds of stuff. And it's just everybody's insurance is different, so it's going to be something to look up. HMO says we're the first type of managed care organization developed to control the expenditure of healthcare dollars and to manage the care. They manage it for you. You don't really do a lot of managing. HMO contracts with employers to provide health services for their employees, and they usually select a primary care physician from whatever their group is, and then, like I said, everything has to go through them. And a lot of times they just assign you one. Point of service says it is a plan in which the member may seek care outside the network or directly from preferred. This is like your PPO. They usually pay a deductible or a copay or co-insurance fees. And I'll show you all. Well, it says the Kaiser Foundation Health Plan is a type of prepaid group practice HMO. They have their own medical facilities and directly employs physicians and other providers. So sometimes you'll see that they have a, specifically with one. And I think a lot of hospitals work that way too. Like it's free for employees to use that hospital's facilities or whatever. Workers' comp, we already talked about that. The injured worker would have no bills or anything. They would not pay for anything. Managed care organizations, they contract with everything, like we just said. The goal is really to keep healthcare costs down because they contract, they can work out a cheaper rate because they're going to get more business or whatever. So as an independent practice association, it says a closed panel HMO. It contracts with independent physicians, so the physicians themselves. Again, with the capitation fees, you'll see that a lot with HMOs. And then a PPO usually is the route most people take, but it just depends. I did an HMO when I worked at Children's, and it was fun. And it was easy, and it was cheaper, and didn't work out. But I didn't really have anything major. I didn't have any surgeries or anything like that. Okay, the government plans, Medicare, Medicaid, and then these last two are both your VA programs, TRICARE and CHAMP VA. Okay, we know Medicare, this is usually for 65 and older or dependents of people who had Medicare. Or sometimes if people have been disabled, they can get Medicare. Sometimes kids can be on Medicare if they have a disability. So there are some of the kind of extenuating situations. The same benefits are in all 50 states. It's a federal program. Medicaid is state. It's run by the state. Medicare is run federally. So 65 and older or younger ones who are disabled or could be a widow. Medicare, so Medicare has different parts that cover different things. Part A says those eligible for Social Security benefits are automatically enrolled in Part A. One other thing to know about Medicare is it only covers people who have actually worked. They have to have worked. It's usually, I think it's, at least last time I checked, it was 40 units, which is basically 10 years. You have to have worked that long to qualify for Medicare. Been putting into Medicare for that long, not necessarily just worked in anything, but have actually, like, Medicare's been taken out of their paycheck for that long. So this covers stays in hospitals, nursing home, nursing facilities, and any psychiatric hospital. This is a part of Medicare that covers that. And then home health care as well. Home health and hospice is covered under Part A. Part B is like your physician appointments, outpatient health care. And says anyone eligible for Part A can choose to enroll in Part B by paying monthly premiums. That may be a little bit different, but many Medicare enrollees also carry private supplemental insurance, like I told you guys about motor insurance, to help pay that 20% copay. Okay, Medicare Part C. These says Medicare Advantage Plan, which was, these are like Medicare HMOs, basically, is what happens. And I hate them, at least from a home health perspective. They were really tricky. Like even my grandparents had several people over the course of a few years would come to their home and like go through this whole big spiel about how Medicare, this Medicare Advantage plan or that one, there's several of them, was going to be this great thing for them. And usually in the end, it ended up not being so great. It would cover less than what Medicare actually covered on its own. So they may be better now. Of course, it's been a few years since I've really dealt with that, but and then they'd end up having to pay for this Medicare Advantage plan. Well, you don't pay for regular Medicare. You're automatically get it. So, but they made it sound really confusing. And you think about it too. A 90-year-old person, sometimes they're just not as sharp as they once were, and so they may not catch that, they're being duped kind of thing. So anyways, I just think I don't like them. From a home health standpoint, a lot of times they would not cover what regular Medicare would cover, and they just wouldn't understand. Or they have a bill for home health services, whereas Medicare Part A covers everything in home health. They didn't ever have to pay a thing. They were on regular Medicare. Part D is the part that pays for the drug. So that's the part that you would be dealing with most often. So this is, says in order to be eligible for this, you must first join an insurance company. There usually is kind of a supplemental kind of Medicare thing, Part B. Okay, Medicaid is a health benefits program designed for people who basically bring in under a certain amount of money per month. It's based on a monthly basis, so every month, depending on what they make, that's how you determine what if they're eligible for Medicaid or not. And it just depends. I don't remember exactly right now even what the rate, like the yearly rate is or monthly rate is, but it just depends state to state. Like I said, it's monthly. They get a new Medicaid card every month. So it's not like a little insurance card. It's a paper that's got all their info on it. For children, CHIP, the Children's Health Insurance Program, is actually, there's a higher step that people can make more money and still qualify for CHIP than they can for traditional Medicaid. Usually, they don't have to pay for anything. Generally, not always, but usually they don't have to pay anything on Medicaid. Okay, TRICARE is one of the VA plans. So they offer a few different things. There's PPO, HMO, and then a fee for service, so they can kind of determine from there what they want to do. I was just reading on the difference in these two, and it's kind of hard to tell. But they usually have to go to the VA hospital. So, like if people want VA to cover something, especially in this area, they'll go to Bonham. They get lab work done there. They have their own pharmacy there at the VA. I mean, everything's done there. CHAMP VA is another type of VA government program. It says it covers the expenses of families of veterans with total permanent service-connected disabilities, as well as any dependents they might have. So they're also covered, not just the veteran themselves, but also their dependent spouse and families can be covered under these two. Okay, a policy is just, you get a copy of your policy whenever you take out insurance. It's going to tell kind of what's covered and what's not. Some of them, like it says, have exclusions, so they won't cover certain things. Used to, insurances wouldn't cover like if they had already been sick, they wouldn't cover it. What's the word? Oh my goodness. No. Anyways, if my insurance started September 1st, but I was diagnosed with, I don't know, diabetes in July, then my insurance may not cover anything for that's diabetes related.
I know what you're talking about.
I don't know what that should be like a simple word, but anyway. But the Affordable Care Act says that you can't do that, at least with a large group health insurance plan. They cannot deny you benefits based on, a previous diagnosis. They have to cover that. Now, the small group plan, or the small individual health plans, they don't have to follow those same rules. And that was part of the thing with my dad too. He's had a pituitary tumor previously. And so since it came back, that was another reason they didn't cover it. Claims processing, and you said everything's computerized, and it will be that way most places. Most places, not always, but it was home health was. I had to make lots of phone calls to insurance companies. That's one of the major things that I did when I didn't work up there, but it's always fun. Sometimes there's a waiting period, so you may have to work somewhere for like 3 months before they'll cover anything. Like I signed up for dental insurance, and once it starts in September, they have to wait 6 months. I have to wait 6 months before I can have it'll cover anything major. It's just part of it. Secondary payers, so sometimes that's kind of like when I talked about my grandparents. Medicare would be the primary payer, and then their supplemental insurance would be everything else would go to them at that point. Let's see. spot here. Okay, HIPAA. We said we're all pretty familiar with HIPAA at this point, and all of you guys have done the HIPAA thing online, right? Okay, so we know that this ensures privacy, and we've talked about this. Payment, so since the pharmacy insurance specialists track claims, they're going to check and make sure everything's done. Sometimes they reimburse the patient if they've had something, they've overpaid or whatever, and sometimes that happens. An overpayment is payment made by the insurer or the patient that's more, you have to send it back. Okay. Electronic claims adjudication. Ensure, they're just going to look at it and make sure that everything's been paid correctly. It's not something that you would necessarily have to do. Law changes all the time. One thing that will be important is just January 1st. I would assume that January is probably kind of a nightmare in the pharmacy because most people's insurance is changed. If they're going to change, they change January 1st. It usually goes on that yearly basis. Now for teachers, ours is every year. September 1st is when our year starts, but most of them it's January. Fraud, it says intentional deception, misrepresentation that results in unauthorized benefits to an organization. So it's felonies. So you want to make sure that you get, you put your information in correctly and all of that so that they can get it done. All right, so your role as far as insurance billing goes, says in the community pharmacy, technicians will use software, like you said that you do in your pharmacy. In the hospital, really, pharmacy tech's not going to do much at all because that's going to be like the billing department. It has its own department that's doing that. That's it. All right, you guys can take a little break.